In recent days, the human Metapneumovirus, that is HMPV, has captured attention due to a rise in cases across several regions, including India and China. Although this virus is not new, it was first identified in 2001. Its seasonal resurgence has raised concerns, particularly for vulnerable groups like infants and the elderly. In India, cases have been reported among both infants and older adults. For example, 2 infants aged 3 and 8 months were diagnosed with HMPV in Bengaluru, and an 80-year-old man in Ahmedabad tested positive. This elderly patient, who had a history of asthma, was hospitalized but is currently stable. Similarly, reports from China indicate a seasonal spike in HMPV cases, primarily affecting children due to colder weather, which facilitates the virus's spread. HMPV symptoms can vary widely, ranging from mild to severe. In adults, symptoms often mimic a cold or flu, including cough, nasal congestion, runny nose, sore throat, fever, and fatigue. For the elderly and those with weakened immune systems, the virus can lead to more serious complications, such as difficulty breathing or even pneumonia. Infants may present with respiratory distress, irritability, poor feeding, and lethargy, with severe cases sometimes leading to bronchiolitis or wheezing. It's important to note that while HMPV can cause significant respiratory issues, it is not as severe as viruses like COVID-19. Experts emphasize that HMPV has been around for decades, and most individuals develop some level of immunity after childhood exposure. Unlike novel viruses that can spark global pandemics, HMPV's spread is part of seasonal patterns observed in late winter and early spring. Preventative measures are key to reducing the risk of infection. Regular hand washing with soap, avoiding close contact with infected individuals, and disinfecting commonly touched surfaces can be effective. For vulnerable populations, such as infants and older adults, it's advisable to avoid crowded places during peak seasons. Strengthening the immune system through a balanced diet, sufficient rest, and regular exercise is also beneficial. While the rise in HMPV cases is concerning, it is largely within expected seasonal norms. Public health experts encourage vigilance and basic hygiene practices to protect yourself and your loved ones. If symptoms of severe respiratory distress arise, especially in young children or elderly individuals, seek medical care promptly. Stay subscribed for more videos.